The XStop is a minimally invasive surgical procedure designed to alleviate painful symptoms of lumbar spinal stenosis. We asked Dr. David Duffner of Desert Regional Medical Center in Palm Springs to explain how this procedure is performed.
Spinal stenosis is part of the normal aging process of the spine. As we age, the bones become thicker, the ligaments become thicker, and the space for the nerves becomes smaller. So the patients that typically develop spinal stenosis symptoms are over age 50 and are still generally healthy and want to remain active. And the symptoms interfere with their ability to stand and walk. If patients have symptoms when they're standing erect and they lean forward slightly and get relief, and then get relief when they sit down, that's a classic case of spinal stenosis. The XStop is a device. The procedure itself is called interspinous process decompression. That just means to put something in to separate the spinous processes. The spinous processes themselves are not contributing to the pathology. We use them more or less as a lever to move the vertebral segment, the spinal segment. So by separating the spinous processes, it opens up the little holes called the intervertebral foramen where the nerve roots come out. And by simply opening the holes, expanding the holes if you will, it takes the pressure off the nerves, and the pressure on the nerves is what causes the symptoms. It's generally indicated for people with mild to moderate spinal stenosis. In other words, if the stenosis is very severe, like a spinal canal diameter of less than 5 millimeters or so, then the person would still need a laminectomy. So I'm not suggesting that it's one operation that will fix everyone, but for properly selected patients, the results are very good.
Dr. Duffner told us how this procedure is performed.
The operation itself is very simple. We make an incision over the spine in the midline, and we separate the muscles off of the spinous processes just for about 1.5 inches, just to create enough room to insert the implant. And the implant is titanium. It's shaped like a bullet because we insert it, this wing comes off and it's inserted through the interspinous ligament, and then we attach this wing with a little screw right here to keep it from coming out. This is actually the XStop inserted in the spine, and the XStop stands for extension stop, and what it does is it just stops the spine from extending. It wedges open this space, and that opens up the intervertebral foramen. So by wedging it between the spinous processes, it blocks the extension, which, as I mentioned earlier, is what causes the symptoms. When you extend your spine and you get the normal lordotic curvature in the spine, that's when the nerves are pinched. So this simply stops the extension at that segment. The clinical results are very good. This device has only been available, FDA approved, for about 3 years. It was actually developed in San Francisco, and the group in San Francisco that did the FDA study has an additional 2 years history. So there's about 5 or 6 years of experience with this, and so far the results have been very, very good. Patients that have this operation do better than controls that are managed without surgery. The improvement is virtually immediate, and the studies that have been done to date show that the improvement lasts up to 2 years. And that's about the longest experience that we have with the device. So it is fairly new, but so far the results are very promising.